Today on Ask Dr. Lori, we're talking about stomach acid, and this is a topic that is a little bit foreign to me because you can have too much, you can not have enough, and there are symptoms related to both, Dr. Lori.
Thanks, Dave. Yeah, this is a great topic because it's confusing to many people, even physicians. And so I think the first time I came in contact with somebody saying to me, you don't have enough stomach acid, I looked at that person and I said, you're crazy. You're absolutely crazy. I learned in pharmacy school that is not the case. I know my physiology. Well, that is the case. And after studying functional medicine, now I have a different approach. There is actually a medical condition called hypochlorhydria. And that means that you have the inability to make enough stomach acid in order to digest your foods appropriately. So as we age, maybe you didn't know this as well, as we age, we actually are making less stomach acid. So the older we get, the less stomach acid we're making, so therefore it makes it more difficult for us to digest our foods appropriately. So this is where people start getting that thought, I'm having acid reflux, because they start feeling the acid indigestion, the food starts coming up through their throat, and they're like, okay, well, the reason why this is happening is because I have too much acid in my stomach. It's exactly the opposite. There's not enough acid in the stomach to break down the foods that they used to be able to break down, and now it's becoming a harder chore for the body to actually digest every single meal that you're eating. So that condition, hypochlorhydria, is very real and happens to many people. And of course, the pharmaceutical industry has grabbed onto this and created a complete different picture to where I think 2009, the estimate was that there was 110 million prescriptions filled for acid reflux drugs in the United States. And I have a hard time believing that Mother Nature has created a condition for us that 1 in 3 Americans has acid reflux or gastrointestinal acid reflux, GERD. So to me, it just seems kind of silly. And now as a pharmacist for 15 years, I looked at it completely different as like, they need a drug, they need a drug. And in actuality, they don't need the drug. What they need is more stomach acid. Is that still confusing to you?
Well, it's getting clearer, but you just don't go out and buy more stomach acid. Your body has to create it naturally, doesn't it?
So yes, that's what's interesting. So there is a way that you can supplement and you can help your body create more stomach acid. The problem that we're running into right now with our society in general is everybody's going out and going on the over-the-counter drugs, and they're buying the drugs that cause us to suppress the stomach acid. And we already have a condition where we don't have enough stomach acid as it is. Now we're suppressing it even further. Now digestion becomes even harder. So would you like to hear some of the things that people might have as symptoms?
I'm very curious because it sounds backwards, at least at what we've been told for many, many years.
Well, it does sound backwards, but when I talk to clients, in fact, I just had one yesterday, when I talked to clients and I said, ask me if this is how you feel. So I'm gonna tell you, this is what they said. You don't feel good when you eat meat. So basically what happens with people who have very low stomach acid is after you eat, especially like a beef meal or something that's heavier, more poultry, something that's going to sit in your gut, it feels like a ball going through your system. It just literally feels like it's not being digested, and immediately you start feeling uncomfortable after you eat. So, and that's exactly what's happening. It's not digesting. It's not breaking down. So food's supposed to, in your stomach, break down into what's called chyme, which is a liquid form of the food. And that's what stomach acid is for, is break it down into this liquid form. And it's supposed to go through your small intestines, and then that's where it absorbs the nutrients. And then the colon is where the waste is collected, and that's how you get rid of it out of your body. Well, what happens with low stomach acid, you're not breaking it into this chyme or this fluid, and so it's going straight through in this ball. So if you didn't chew appropriately, it's going through in solid food form, and it's going to continue through your system in solid food form, and that's not going to feel good. So it's not going to feel comfortable. You're going to have a lot of distension. You're going to have bloating. You're going to feel a lot of people have a lot of abdominal pain. That's what puts a lot of people in the emergency room, is that upper abdominal pain. And a lot of them happen right after they have a huge steak dinner at a restaurant. It's like, ooh, that really smarts. It's because they're not digesting it. It's sitting there in a ball. Acid reflux, again, that's another one of the symptoms people experience. Like I said, again, pharma's done a great job of telling us that we have too much acid, but by suppressing that even further, we put ourselves into a really bad place. So what ends up happening is that when the food gets into the small intestine, it's not digested appropriately. So now it's being digested rather than your enzymes and the stomach acid, it's being digested by bacteria and yeast. But that's when it's being digested by bacteria and yeast, that's what's causing a fermentation process or putrefaction process. That's what creates those gases. So when people say I get gassy right after I eat, where I feel like my stomach starts blowing up, that's why. It's because your food's being digested by bacteria and yeast. And that's causing a fermentation and causing all this gas to be released. And that's when you get really distended. So that's kind of a signal that you might have low stomach acid. And then here's just a few of the symptoms, and I've got them written down here so that I don't forget, because these are really important for the audience to understand. Is number one, you would have several burps right after you finish eating, or burps that smell really bad or taste really bad. That can give you an indication that the food's not digesting appropriately. Yeah, that's pretty gross. You're making faces, so I know it's gross. Experience gas 1 to 2 hours after eating. So a lot of people will start experiencing that and wonder, what was it that I ate? And then they're going to reach for the Tums. Bad idea. You get bloated after you eating. That can last for a few hours. So some people are really miserable for up to 4, 5, or 6 hours after they eat. You get that heavy feeling like your stomach is, the food's just sitting in your stomach and it's not going anywhere. And again, that's because it's being fermented in your gut and you're not digesting appropriately. And why is this bad? So why would we be concerned about this low stomach acid situation, and how is that going to ultimately affect us? Well, number one, it doesn't make us feel very good. So we have all these symptoms that we're trying to treat with a drug, which is something that we probably shouldn't be doing. But number two, stomach acid is needed to absorb many nutrients and minerals. So if you don't have enough stomach acid, you're going to have a deficiency. And you're going to have deficiencies in iron, zinc, copper, and calcium. So it can affect your bones. Also, vitamin B12, which we know is very crucial for energy and many enzymatic processes in your body, is not being absorbed when you don't have enough stomach acid. So all of my clients are low on B12. Folic acid and protein also are not being digested and absorbed appropriately. It's crucial for your immune system. So if you're not getting enough stomach acid, it's not breaking down the bacteria that's sitting in your small intestine, and so you can get bad bacteria overgrowth, where that's where a lot of my clients get very sick. And then here's the worst one. You actually can eat, but be malnourished because basically you're not absorbing the nutrients from your food, which is where I'm noticing a lot of my clients when I do hair testing with them and look at their hair tests and they're like, but I take all these multivitamins and I eat really healthy. But if your digestion's not working, you're not absorbing the nutrients from the food. So it doesn't even pay, because you keep eating and eating, but you're not getting any of the nutrients that are usable for yourself.
So these symptoms seem, I mean, the list of symptoms are pretty obvious now. I'm sure people are going, okay, yes, got it. No, but I got that one. So
Right.
How do we solve this problem?
So there's a couple things that you can do. There are some supplements out there that we can actually add stomach acid. So there's a product called betaine hydrochloric acid that I use on my clients, together with some really good quality digestive enzymes. So that'll help them digest their foods more appropriately. We need to start replacing that rather than hindering it by taking more of the drugs that cause us to have issues. Now, disclaimer on that as well. You can't just flat out stop taking your proton pump inhibitor like Nexium, Prilosec, Protonix. Quitting cold turkey could be really bad. We have to taper you off, and there's a way to do this the right way. So I wouldn't suggest to the lay public doing this on your own. This is something that I would say schedule a consultation with me. Let's work together with your physician so they know you're doing this, and let's do it the appropriate way so that you don't get halfway through the taper and say, this is too painful because I'm having repeat acid reflux and I need to stop this. So we need to be really cautious with that. So I would say get a hold of me on the website, www.healyourselfbeautiful.com, and ask for a consultation with me.
Sounds like a great idea. And if you have any questions on this show, use the hashtag AskDrLori, Twitter, Facebook, or YouTube, and we'll do our best to bring it up in a future episode. So with that, Dr. Lori, thank you.
Thank you.